A shocking case of alleged medical negligence from Edmonton in Canada. A 44-year-old person of Indian origin was admitted to hospital because of suspected cardiac issues. For 8 hours, he kept waiting for treatment and sadly passed away, allegedly due to lack of effective treatment. And this isn't an isolated incident. There's another incident that was reported from Toronto, and back-to-back incidents of alleged medical negligence or lack of medical care, especially when it comes to people of Indian origin, has led to questions being raised about the quality of healthcare in Canada. We get you more in this report.
The triage, complaining of constant chest pain.
Medical negligence.
Constantly kept on rising with the last recorded blood pressure of 210.
Dereliction of duty.
Inside, he was only prescribed Tylenol.
And a life lost.
In time that he was outside.
On December 22nd, Prashant Srikumar, a Canadian of Indian origin living in Edmonton, complained of severe chest pain while at work. He was rushed to the Nuns hospital within 20 minutes. There he was made to wait 8 hours before he was given any treatment. Prashant told his father that he could not bear the pain. He also conveyed the same to hospital staff, stressing that his pain level was 15 on a scale of 10.
Monday, December 22nd.
Yet all that he reportedly got was some Tylenol. He was told there was nothing of significance in the ECG report. The delay ultimately cost him his life. His wife shared the ordeal.
So Prashant Srikumar complained of acute chest pain at 12 o'clock noon, and he was brought to Nuns hospital by 12:15, 12:20. He was sitting in the triage from 12:20 onward till about, I would say, 8:50 on. His BP constantly kept on rising with the last recorded blood pressure of 210, and he was not given help. They said that chest pain is not considered acute.
Prashant is survived by his wife and 3 children. Canadian journalists came down heavily on the country's poor health infrastructure.
We did not increase capacity in the medical field. The only people we added into the medical field in the last 10 years are bureaucrats to pretend we're adding more medical fields. So we've just made the problem even worse by swamping a giant bureaucracy onto a mass problem. So that's why people are dying in hospitals.
The challenge is mainly in the emergency room, where it is overcrowded, and you have to wait 10, 12, sometimes 14, 16 hours. And in the meantime, if people have this kind of real emergency or acute problem, they have to face these kind of consequences.
Another shocker from Canada. Indian student Shivank Awasthi was shot dead near the University of Toronto Scarborough campus. The authorities are probing the case as a homicide. The Indian embassy expressed grief over the incident. The embassy says all necessary assistance is being provided to the victim's family.
We are in touch with his family. It's very unfortunate. We convey our deepest condolences. We are also in touch with local authorities as to what the circumstances, etc., that led to the death. We'll come to know of those details more, but we are in touch with local authorities in the matter.
The threat to people of Indian origin living in Canada has increased over the last few years, according to journalists.
Are things getting a little bit more uncomfortable socially in Canada, especially as it goes for immigrants, particularly Indians? Yes. There's a rising culture of, anti-Indian sentiment being pushed by a lot of different factors, some of them you're familiar with in India.
Canada, which is home to a large Indian origin population, has witnessed several such incidents of discrimination and violence lately, raising serious concerns. With Pranay, Upadhyay, Bureau Report, India Today.